the CDC, the public health folks, will tell you they answer to a different God. But they had one guy there. They always have one guy there. And he got up and he said, "You can do whatever you want. You can pass this is to the United Nations General Assembly group. You can do whatever you want. You can pass whatever you want. We're not going to follow what you do. We do what we think is best. We're above the law."
Because the public health, and there are other parts, but in this context, public health doesn't have to follow the same laws. That's the strange thing. The laws, in most cases, are passed for people like you and me. The government people generally are not under those laws. Furthermore, they have the power in taking laws to issue what they would call advisory opinions, which are basically, Congress passed this, we think they really meant to do that, so that they don't follow it that way. The government was very careful to limit our ability to look at multiple vaccines. One of the tricks that they used is, we said we want to look at all the vaccines. Okay, they cut them, each one of them, into a separate file that you couldn't combine back together again. So we're left looking at one vaccine at a time, but it turns out we're so clever that, at least in the case of mercury, we could figure out based on which kind of vaccine. Some had mercury, some didn't, some had more or less. Those kind of things we were able to do studies, but the raw study that I know all parents want to do, vaccinated kids, unvaccinated kids, let's compare the rate of disease. They were extremely careful to not let us
When we tried
do
to
that.
put some together, that was one of the charges against
Yeah.
us. Our illegal work. We tried to use the computer to put them back together again. We're pretty smart. We could do it. So they were very afraid of somebody subpoenaing the database. The database that they were forced to give us was from 1990 to 2099, 2000. Beyond that, the database continues, but they don't have it.
The government
you
claims they don't
you
have it.
can't subpoena what you don't have. It's not in their possession. They spend several $100 million to have a company keep it, and they lose the money if anybody else gets to see it.
It's a shell game. Basically, what has happened is, on pieces of paper, the VSD data, which is being kept continuously from 2001 all the way through probably this last year or maybe year before, is kept legally over here. CDC is over here. The data comes from over there, but yet CDC over here has access to all of it, but it's sort of over there separate from them. That's the idea. And it's been very effective. They did it right at the time that Congressman Burton and us and others were putting the maximum pressure on us. That was designed, for some reason, I don't know exactly, the older data between 1990 and 2000, that seemed to be cut and made separate. Maybe that was just a compromise. But after that line, everything went in a new direction. It has something to do with the American health insurance plans, which is out of DC, but I don't think they really store the data. I think it's with the CDC. It's just not clear.
It's a shell game.
Yeah.